Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Wednesday, February the 17th. This is week 50 here in Montgomery County of the COVID-19 pandemic. And today I am joined by my colleague, Commissioner Ken Lawrence. I have a bunch of very detailed updates this afternoon, so please bear with me as I work through this. First of all, I want to give an update on our clinic schedule for this week, our vaccine clinic schedule for this week. Due to a combination of inclement weather and not receiving enough first doses of vaccine this week, we have decided to close our first dose clinic at Norristown High School this Thursday and Friday. We are also going to close our second dose clinic at the Montgomery County Community College tomorrow, Thursday, and this clinic may have a delayed start on Friday morning, depending upon the weather. Issues with decreased supply of vaccine continue to impact our operations, and we are only booking appointments when we have vaccine available. Also, we want to make sure that our residents coming to the vaccine site, as well as the staff working at those sites, are safe during winter storm events. When we do need to cancel a vaccine clinic for weather or any other reason, individuals with appointments will be notified by email. You will receive 2 emails from the same name, and that is Vaccination Clinics. And the email address will be noReply@multistatep4p.com. The first email will tell you the date and time of your rescheduled appointment. The second appointment was canceled. So I know this was a little confusing the last time this happened, so I just want to make sure everyone's clear. You get 2 emails. One tells you your new appointment, and then the second one tells you that your original appointment was canceled. Biggest thing to remember is that if we do have to close for inclement weather, you will be rescheduled automatically. You do not have to reach out to us. As for next week, right now our plan is the following. If you are scheduled for a second dose at Montgomery County Community College tomorrow, Thursday the 18th, we are going to reschedule you to Monday at the Norristown High School location. Therefore, on Monday, we will have 2 second dose clinics, one at Montgomery County Community College as planned for everyone who is supposed to be there on Monday, and a makeup second dose clinic for tomorrow's individuals, and that will be at the Norristown High School on Monday. Beginning Tuesday, we will resume first doses at Norristown High School and continue second doses at Montgomery County Community College. Up until this point, we have been giving the Moderna vaccine at our clinics. Due to Moderna supply issues, which I'll address momentarily, we will now be distributing the Pfizer vaccine for first doses starting on Tuesday, February the 23rd. This switch is based solely on which first dose vaccine is available to us from the Pennsylvania Department of Health. Both the Moderna and Pfizer vaccines are highly effective at preventing COVID-19, so this should not be a cause for concern. You may also be aware of the announcement today from the Pennsylvania Department of Health of a statewide shortage of Moderna vaccine. We have been told that we will not receive a sufficient amount of second dose Moderna vaccine to cover the 5,279 people scheduled for second doses next week. I want to reassure anyone who is expecting to receive a second dose next week that if we are not able to offer you a second dose next week, we will contact you and schedule you for a future date. We will ensure that this future date is within the CDC maximum approved interval of 42 days. We are working closely with the Pennsylvania Department of Health to make sure that is the case, and PADOH has assured us that they will make sure we have enough vaccine in time to provide that second dose within that approved maximum interval of 42 days. As this week demonstrates, the logistical challenges of operating our mass vaccination clinics is changing weekly, and I must again ask for your patience and flexibility. We remain hopeful that vaccine supply will increase over the next few weeks, and we will be ready to ramp up our operations to vaccinate more people as soon as more vaccine is available. Moving on to our COVID-19 hotline. As a reminder, our COVID-19 hotline is now live. The phone number is 833-875-3967. The Montgomery County COVID-19 hotline is operational 6 days a week, Monday through Saturday, from 8 a.m. to 8 p.m. Live operators will be available to answer your COVID-19 questions. In addition, the hotline has language line support for over 100 different languages. We encourage people to call this number or email covid19@montcopa.org with general questions about COVID-19 and the COVID-19 vaccine. Please note, the hotline cannot provide updates on where you are in the vaccine pre-registration line or troubleshoot issues with vaccine appointments. It is only for general information. Very shortly, residents will be able to use the hotline to pre-register by phone with the county for vaccine. Our team has started a soft launch and is testing this function this week, and we plan to open up for phone pre-registration next week to anyone who needs help with accessing the system. Now, for those of you who have already pre-registered on our site, we will be continuing to send weekly emails to keep you updated on our vaccination progress and what you can expect when it's your turn. As of 9:30 this morning, we have 165,320 people pre-registered. At this time, and depending upon when you registered and how quickly we continue to get additional vaccine, it could be at least 12 weeks before you hear back from us about scheduling an appointment, and it could be longer. We now have information on our website to give those of you who have pre-registered some idea of where you are in the line. On our vaccine page, there's now a link next to a blue flag that says Status of Vaccine Registrants. This link will take you to a chart that lists how many individuals pre-registered each day beginning January the 12th. If you know the date you registered, you can see how many people are ahead of you. Currently, we are registering people for vaccine appointments who registered on or before January the 13th. The website also now displays a running total of how many doses of vaccine we've received and how many doses we have given, and that will be updated weekly on Wednesdays. To get to the vaccine page, go to montcopa.org/COVID-19 and click on the vaccine information button at the top of the page. Now, as we've discussed several times in these briefings, we have had some challenges with individuals sharing appointment links. This week, our team began the process of issuing each person a single-use token to book their vaccine appointment. This will allow us to eliminate the link sharing issues and prevent individuals from jumping the line. We will require that individuals show us their token number and name when they arrive at the vaccination site. So please make sure you save that email or write down your token number and bring it with you to your appointment. I want to thank our team that has been working nights and weekends to fix these issues and to make the registration process run more smoothly. Now, some of you know when you tried to register this week that there was a problem with the registration. It turns out that that problem was not with our new token system. The problem was entirely with the PrepMod system that ran a software update overnight, Sunday night into Monday. And as part of that update, it requires that people have cookies enabled on their internet browser. And if they do not, then the system will not work and allow the individual to make an appointment. So we will be updating all of our information that is contained in the email to an individual when they receive an appointment link. It will go through in detail what is needed in order to make the appointment and what to do if you have any problems getting that appointment scheduled. So I do continue to be encouraged by the enthusiasm that so many people have to be vaccinated. And as I said earlier, I do have to continue to ask for your patience. We'll share our weekly graphic to give you a sense of the progress that we're making. So this first rectangular box at the top is just the doses that the county has received, or the county health department. These are not all the doses that have come into the county, but these are the doses that the county health department has received. We have received 26,400 doses to date. We have administered, as of the end of the day yesterday, 24,063 of those doses. So we have about 2,300 remaining first doses. And as you know, we can give about 1,000 doses a day. So we have about 2 days of vaccine left, depending on how many are actually given today. So far, we've not received any additional first dose vaccine this week. We still hope that and have been told that we will receive some. But again, until it arrives, particularly with this weather situation, we're not going to count on it. The bottom half of this graphic gives you a broader picture of the county. So as we've discussed, we know that we've got about 151,000 people that are age 65 and older. We've estimated about another 100,000 people who have one of the known or named pre-existing conditions that put them at particularly high risk from COVID-19. We still have somewhere between 5,000 and 6,000 healthcare personnel that need to be vaccinated. So we have still about 255,000 people still remaining to be vaccinated in the 1A category in Montgomery County. But despite all of these challenges, progress is being made. So as of the last night, we have 70,579 people, Montgomery County residents, who've received a partial vaccination. They have received their first dose. And we have 24,287 that have received both doses. As a reminder, if you would like to be vaccinated and have not yet pre-registered with the county, anyone 65 and older, or those ages 18 to 64, and actually we'll now be able to drop that down to 16 to 64 now that we'll be receiving some Pfizer vaccine, who have one of a dozen specific underlying medical conditions, are encouraged to pre-register to receive the vaccine from the Montgomery County Office of Public Health. And you can do that by going to montcopa.org/COVID-19. Click on the vaccine information button at the top of the page. We still have a map on that same page where you can see other vaccine providers located in Montgomery County. This is a map that the Pennsylvania Department of Health updates. And there are pharmacies, a handful, that are getting vaccine in our county. So I urge you to also take a look at that map. Now, moving on to our regular update. Since the February 10th press briefing, we've had 940 new cases of COVID-19 reported in Montgomery County. This is for the dates inclusive of Wednesday, February the 10th through Tuesday, February the 16th. This is a daily average of 134 cases and brings us to a total of 45,372. These are positive cases as a result of a positive test for the virus, not from the antibody test. 35 of these are from long-term care facilities. 1 is from the Montgomery County Correctional Facility. 10 are from other congregate settings, and 894 are from our community. These positive individuals live in 57 of our municipalities, and as you know, all 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 5 days old to 100 years old, and you can check our county maps at montcopa.org/COVID-19 for updated geographic information. Today we have 483 females, 455 males, and 2 unknown. I am sorry to confirm that 15 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,181 deaths confirmed positive from COVID-19. This week, these 15 individuals ranged in age from 38 years old to 97 years old. 13 died in a hospital and 2 in a long-term care facility. Overall, 602 females and 579 males have lost their life to COVID-19, and they ranged in age from 25 to 106. Our racial breakdown as we have it: 2 American Indian or Alaska Native, 33 Asian, 6 Asian Indian, 5 Asian Korean, 138 African American or Black, 600 white, and 397 unknown. The situation remains stable at the Montgomery County Correctional Facility. All inmates that have tested positive for COVID-19 are in isolation and stable without symptoms. Routine antigen testing continues for all of our correctional officers. Our positivity rate continues on its downward trend this week, which is great news. Our 14-day average positivity rate is down to 6.72% as of Thursday, February the 11th, compared with 7.54% as of Thursday, February the 4th. And this is our 14-day positivity graph. Just a quick reminder that the orange squiggly line in the background are the number of tests done each day. And the blue line is that 14-day running average of positive tests. So you can see it is definitely taking a downward trend. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph shows the daily positivity rates from January the 15th to February the 11th. I'm very happy to point out that we fell below 5% on 2 of these days. The last time that we were below 5% was November the 4th. So this is great news, and hopefully this trend will continue in the weeks to come. Our hospitalizations continue to remain high, but have improved significantly since last Wednesday. Today, 162 individuals with COVID-19 are hospitalized in a Montgomery County hospital. This is decreased from 239 last week. 17.2% or 28 of these individuals are requiring a ventilator. Our hospitals do remain quite busy. To put this in some context, on October 1st, there were 24 patients hospitalized with COVID-19 in a Montgomery County hospital. I do want to just point out there's a little blip on our hospital graphic, which you can see yesterday and the day before. There was a sudden dramatic increase in the number of hospitalized patients. That was a data acquisition error. We pulled this chart from the Pennsylvania Department of Health website, and there was just a glitch in how they were pulling data, and we got some cases attributed to our county that were not our cases. So that has been rectified today, and that 162 number is a number I have confidence in and I believe is accurate. So in terms of testing, we do continue to see a decline in testing among our residents. For the 14-day period that ended February the 11th, 38,609 Montgomery County residents were tested, which is a decrease of 4,534 people tested compared with the 14-day period ending February the 4th. I do want to really continue to urge people to be tested. This is our best way to keep a handle of what's going on in the county. So if you need to be tested or just want to be tested, we would encourage you to please be tested. So let's see what this looks like graphically, and we'll move on to our date tested graph. As a reminder, the gray bars are the number of positive cases on that given day. The red is the 7-day average of all of the cases in the county. The pink is the 14-day average of all of the cases in the county. The dark blue and the light blue are the 7-day and 14-day averages of cases that are from the community only. And then way down at the bottom, the orange and the yellow are the 7 and 14-day averages of long-term care cases only. So you can see we are making very good progress. You can see how long it is taking us to return to our pre-Halloween baseline. We're still not there yet, but I do hope that we will be there within a couple of weeks. And next we can zoom in on these last couple of months to give you a better sense of how we have ebbed and flowed through the holiday season. Certainly the holidays just had an enormous impact on the cases here in the county. And hopefully we'll continue this downward trend as we both make sure that people are wearing masks, socially distancing, keeping their hands clean, as well as we get more and more people in the county partially and fully vaccinated. So again, just a reminder that our testing sites are open, all 6 sites, Monday through Friday. They have varying hours each day, so check the site before you make an appointment. As a reminder, you can go online to make an appointment at montgopa.org/COVID-19 under the green County Testing Information buttons. You can start to make an appointment on the day that you would like to be tested online beginning at 7 a.m. You cannot book ahead. If you would prefer to make an appointment by phone, the phone registration opens up at 8:30 in the morning, again, for the day that you want to be tested. That phone number is 610-970-2937, and language line is available at that phone number. So before I turn over to Commissioner Lawrence, just want to remind everyone that we do remain in a rapidly evolving situation. Happily, our number of cases continues to go down steadily, which is fantastic news. But our vaccine situation is variable from week to week. There is definitely more vaccine coming. I hope that 8 weeks from now, we have been able to dramatically increase the number of people who are vaccinated. But between now and then, it is going to be a changing situation from week to week. And the amount of vaccine that we have is dramatically less than the number of people that want it. So while our eligibility is quite large, as we've said, about 250,000 people in the county are eligible for vaccine, we are getting tiny amounts of vaccine into the county each week. And so it is just going to take some time until we are able to reach all of you who are, I hope, somewhat patiently waiting for your turn to come. And with that, I'll turn over to Commissioner Lawrence.
All right, thank you, Val. Today I'm going to provide the final update from our Montco Strong 2021 Restaurant Grant Program. All of the grants have been approved now in the final round. A total of 600 restaurants and food services businesses are receiving a total of $6 million. And the final round should have started receiving notification yesterday. These applications for grants went live on December 30th and closed on January 8th. And grants of $10,000 were awarded to each qualifying business. The grant funds come from an appropriation of $6 million in county economic development funds that the county commissioners approved to support restaurants and other food service businesses that have suffered financially due to the COVID-19 pandemic. In addition, last year, Montgomery County awarded nearly $20 million to help small businesses and nonprofits struggling due to the impacts of COVID-19. We recognize that our restaurant industry is a cornerstone of our economic and workforce development, as well as central to the growth of entrepreneurship, job opportunities in our communities. Many of our restaurants are small businesses and help define our communities. And when they suffer, our communities suffer. The limitations on indoor dining and the loss of outdoor dining during the winter months have been brutal on many restaurants. Eligible grant applicants must have been a for-profit restaurant, food truck, deli, bakery, brewery, distillery, vineyard, caterer, or other food service for-profit entity with a physical location in Montgomery County, Pennsylvania. They must have been in operation since at least January 1st, 2020, and experienced disruption due to the COVID-19 global pandemic, while also meeting several criteria that was listed on the application site. I want to provide a little demographic data on the 600 awardees. 56 of our municipalities were represented. 33% of the businesses identified as minority owned, 33% identified as women owned, 4% identified as veteran owned, 31% received a Montco Strong grant in 2020, and 66% indicated they had received a Paycheck Protection PPP loan from the U.S. Small Business Administration in 2020. Eligible grant expenses include rent or mortgage payments for a business location, payments for utilities for a business location, purchase of personal protective equipment, and payroll for non-owner employees and or their family members between the dates of January 1st and March 5th, 2021. A list of the currently approved grantees can be found at www.montcopa.org/commerce. And I want to share two messages that we received from restaurant owners who received these grants so far. We are so appreciative to have received this grant for our business. We never thought we would see more than a year in our industry and business. I cannot tell you how much this grant means to us. And that's from Ryan Rosen, co-owner of the Leslie Rosen Catering. And when I received the email, I was working on some brewery paperwork at my house at home. I jumped out of my seat. The grant funding will be very helpful in carrying us through these difficult winter months. We are grateful for being selected as one of the Montco Strong 2021 grant recipients. And that's from Kelly Weiss, the owner of the Perkiomen Valley Brewery. So I'm glad to hear that these grants are already making a difference and having an impact. And that concludes my report, Val.
Thank you, Ken. I'll just announce that our next virtual briefing will be Wednesday, February the 24th at 1:30 p.m. And we'll take your questions now.
Thanks, Commissioner. Just as a reminder for our reporters, due to time constraints today, we'll have a limit of 2 questions per reporter. We'll start with Jim Melwart from KYW.
President Biden saying he wants as many K-8 schools as possible 5 days a week within his first 100 days. We're seeing surrounding counties relax their classroom distancing standards. Does Montgomery County plan to relax its guidance in any way?
I don't have a firm answer for you on that today. I know that my team is meeting to discuss that and are looking at the CDC guidelines and looking at the incidence of cases here in the county. And they'll be giving advice to our school superintendents this week.
Do you or does the county have any reason to believe that schools in Montgomery County who are back in person 5 days may have either hidden, underreported, or not reported link transmission in schools?
I have no evidence of that.
Thanks.
Next, we'll go to Deanna Durante from NBC 10.
Hello, I was wondering if you could give us a little bit more detail on the impact of the vaccine, the second dose vaccine issue that we all just learned about from the state when it comes directly to Montgomery County. Are you being told that your doses are going to be cut for several weeks or just 1 week? How what information are you getting, and how does it impact people as to how this shortfall is going to be made up?
Yeah. So I don't have a lot of details yet. The only thing that we have been told is that we will receive approximately 50% of the doses. Let me be clear, the second doses that we're expecting for next week, but we do not yet have a firm number on how many doses we will actually receive for those second dose folks next week. So as I mentioned, we've got 5,279 people that are expecting a second dose next week. And until I have some certainty about what we're actually receiving, it's hard for me to give you a plan in terms of how we're going to manage what comes next.
Is there a possibility they wouldn't get their second doses, or that you would have to stop first doses altogether in order to make that up?
I think, well, the TADOH has assured us that they will get us enough second doses within that maximum approved interval of 42 days to make sure everybody gets their second dose. So we just have to go with that and believe that that is the case. And separate in terms of first doses, we will be switching over to Pfizer next week, as I said, so that we are not dependent on the Moderna delivery, at least for the next several weeks for first doses.
Thank you.
Our next reporter will be Andrew Valentino from WFMZ.
I would like to defer to the question that my reporter, Will Lewis, sent you guys. I know one of you has it.
Yeah, Kelly, could you read that, please? I think you have that.
Sure. The first question is regarding the reporting of positive cases. At the beginning of the pandemic, the number of positive cases were high in Montgomery County, and now they are going down. We are seeing Lehigh County with high numbers. So what would you suggest bringing those numbers down? Were the Montco numbers high due to more testing?
So in the early days of the pandemic, which is now almost a year ago, Montgomery County was one of the first counties in the Commonwealth to have positive cases. And we were particularly unlucky in that we had a number of people who had gone on various trips to locations where vaccine was spreading. So we had several individuals who had traveled on Nile cruises in Egypt, where there had been boats that had quite a bit of spread, had gone up to a large scientific conference up in Boston and come back to the county with the virus. So our early high numbers was, I think, really just a combination of circumstances and a lot of bad luck here in the county. A couple of those individuals who came back sick were involved in large social gatherings, and there was just a lot of spread from those events. So there was just a series of events that made our numbers high in the early days. And since then, you know, I would say that we've been able to do very robust testing here in Montgomery County. It's been one of our top priorities, and that testing has really helped us know where our outbreaks are and keep a handle on the situation in the county. So you know, we are slowly, steadily coming down. And of course, another big piece of that is people's willingness to wear masks, socially distance, and keep their hands clean. I can't really comment on any other county. I just don't have enough awareness of details of what's happening in other counties, but hopefully that answers your question.
And the second question just relates to the Department of Health announcement. Do you know if anyone at the Health Bureau or affiliated health networks were affected, and how will this handle your administration of the doses?
Yeah, so I think that here in Montgomery County, you know, obviously we were getting Moderna vaccine. Most of our hospitals have been getting some combination of Pfizer and Moderna vaccine. And the pharmacies that have been getting vaccine, I think, have also, many of them received Moderna vaccine. So I would have to assume that many of the vaccine providers in the county will be impacted by this issue with the second doses.
Okay, that's the 2 questions we had from FMC. Thank you.
Thanks, Kelly.
Next, we'll go to Annie McCormick from 6ABC.
Hi, Commissioner. Following up on Deanna's question, I'm just wondering, from your experience as a medical professional, how much of an impact do you think not having the second doses, that issue that was announced today by the Department of Health, is going to have on people? Is that a concern to you at all, the medical side of it, the delay?
Well, I always go back to the data, and we do have some data on this issue because in the very large clinical trials, phase 3 trials that were conducted by both companies, both by Pfizer and Moderna, not every person in those trials got their second dose exactly on schedule. And so based on that data, the CDC has determined that that there is a maximum of 42 days, and it's possible it's even longer than that, but they're comfortable saying at the CDC that there can be as long as 42 days for either vaccine to receive the second dose. But we certainly want to give that second dose because with both vaccines, the first dose does not provide that really good, robust protection. The first doses provide some protection, but to get up to that 90-95% protection, we do need to administer that second dose. So I am watching this situation very closely. I will be in regular communication with the Pennsylvania Department of Health and make it very, very clear to them if we have any concerns here in Montgomery County that there could be individuals that we gave the first dose to, that we are not going to be able to give that second dose within that 42 days.
And that goes to my follow-up. The Department of Health was very clear that they're not going to say who the providers were that provided the second dose. Is that of concern to you, that lack of transparency? You're privy to more information as an official than we are. Have they provided that information to you?
They have not provided that information to me. And the only piece of this that I have actual eyes on are the doses that our Montgomery County Office of Public Health gives to our residents and people who have signed up with us. And I can assure you with 100% certainty that our team has been meticulous about keeping the first and second doses separated, and that here, in terms of our Office of Public Health, the second doses have all been given appropriately. I cannot speak for any other provider in the county.
Got it. Thank you.
Thank you.
Next, we'll go to Justine McDaniel from the Philadelphia Inquirer.
Hi, good afternoon. I also want to follow up on the second dose shortage. Did that come as a shock to the county, and do you have concerns about how this happened? Governor Wolf said a few minutes ago that he thinks the state has adequately addressed the situation. Do you agree, and what do you think the state should be doing?
I was surprised, furious, and disappointed when I got this news, because we have been assured repeatedly that those second doses would be there for us. And as a consequence, we have been giving our first doses as quickly as possible. We have not reserved or wasted any doses. And we did that under the promise that those second doses would be there for us. So, this was extremely disappointing. I don't know, where exactly the problem came up. They have not shared any additional information with me in terms of, where there were providers that perhaps got confused or deliberately gave second doses as first doses. But we will work through this. My team and I have already spent the last week, we actually learned about this yesterday, the last 36 hours really thinking through about what our options are, how we're going to communicate with people who got their second dose through our Office of Public Health, make sure that we don't lose track of anybody. We will get this done. We will find a way. If I have to go camp out at PADOH to get doses, we will find a way to make sure we get these second doses. And honestly, having said that, PADOH seems to have a plan for over the next several weeks, making sure that we have the second doses that we need. But it is likely going to require that some people's second doses are given a little later than what had been originally planned.
Okay, thank you. And, as a provider, I was wondering if you could just give us some detail about what happens when doses come in. I'm wondering where one might go wrong or get confused. Like, are they labeled as first or second when they arrive to you? How do you sort them? You said you guys, haven't made any mistake like that. So I'm wondering if you can tell us how to do it correctly.
Well, I can tell you what happens at the county. And again, I don't know if this is how it happens for others. So I want to be clear about that, but I can tell you what happens for Montgomery County's Office of Public Health. So first of all, there's the ordering of the vaccine, and my team orders vaccine every week for the following week. And they place two separate orders. There is a second dose order that goes to PADOH, and then there is a first dose order that goes to PADOH. And those are two separate forms that they fill out. And then when the vaccine comes, at least it's been our experience that vaccine comes separately. So we'll get one of those orders one day and we'll get the other order the other day. Or I think maybe one day we got them all on the same day, but they were in two different boxes. So, but our team, of course, knowing what we need for the first and second doses, they always make sure they have those second doses allocated for second dose, and then the first dose for the first dose. In our case, we've been running these two separate clinics. So it's a very simple matter for the team to make sure that all the second dose gets to the correct clinic because all the second doses are at one place. So that is our process. It's pretty straightforward.
Finally, we'll go to our communications director, Kelly Co-Francisco, with questions from Rob Tourneau from the Philadelphia Inquirer.
So you might have addressed some of this already, but the question is, Acting Secretary Allison Beam announced today that more than 100,000 vaccine appointments may have to be rescheduled due to the shortages and logistics errors related to the Moderna vaccine. Can you just summarize how this has impacted Montgomery County and how does the county plan to address it?
Yeah. So we have for next week 5,279 people scheduled to get their second dose. And as of right this minute, we do not know exactly how many second certainty about that number. We will reach out to individuals that will need to be rescheduled and we'll put a plan together for them. It's hard for us to define that plan right now since we do not yet know how many people are going to require rescheduling. But as soon as we know, we will reach out to those individuals by email. We're still in a situation now where everyone who's made an appointment has done so by email. So we will be able to email those individuals and we will get them rescheduled as soon as we get clarity from PADOH about when those additional doses will be arriving.
Thank you. That was his only question.
That concludes our questions for today, Commissioner.
Okay, thank you all very much, and we will see you next Wednesday at 1:30.